Hi everyone, it's time for another San Antonio Breast Cancer Symposium update. I'm highlighting two studies that are focused on patients with a BRCA mutation who have been diagnosed with breast cancer. The first study is an update on the OlympiA trial, which looks at adjuvant olaparib for 1 year, so following completion of surgery, chemotherapy, radiation, and so forth, for patients with hormone receptor positive, HER2 negative breast cancer, or triple negative breast cancers with high risk features. This study was presented several years ago, and olaparib is FDA approved for this indication. Olaparib is a PARP inhibitor, and now we see the updated data. And so now they followed patients now for about an average of 6 years, and they found that there is a continued benefit in olaparib. Specifically, they looked at invasive disease-free survival, so being alive without a recurrence of invasive disease, and that benefit is an absolute benefit of 9.4% in patients who received olaparib. So that's really, really impressive. And we also saw a improvement in distant disease-free survival, so being alive without a distant recurrence, and overall survival. So really, really exciting to see the continued benefit of olaparib. Two other things that I thought were really notable about this study. The first is they reported on rates of myelodysplastic syndrome and acute leukemia, because that is one of the rare but very serious side effects of olaparib. And they found that the rates of MDS or AML were actually similar between patients who got olaparib and patients who got placebo, 0.4% in the olaparib arm and 0.7% in the placebo arm. They also shared pregnancy outcomes, and they were actually similar between patients who got olaparib and placebo. So I thought that was really reassuring to see, and if you have more specific questions, leave them in the comments. Now, the second study is looking at the benefit of risk-reducing surgery, so either a bilateral mastectomy or salpingo-oophorectomy, removal of the ovaries and the fallopian tubes, for patients with a BRCA mutation who were diagnosed with breast cancer younger than the age of 40. And what they found was that having a risk-reducing surgery reduced the rate of death, it reduced the rate of recurrence, and it reduced the rate of secondary new cancers. And specifically, if you had a risk-reducing bilateral mastectomy, it reduced the rate of death by 35%. And if you had a salpingo-oophorectomy, it reduced the rate of death by 42%. And the survival rates were similar whether people had both surgeries or one. But if they had both surgeries, it actually had a more kind of a cumulative effect for people with both surgeries in lowering rates of recurrence. So I thought that was really, really interesting and really highlights the importance of risk-reducing surgeries. Now, it'll be interesting to see, because there's all these studies now looking at having a delayed oophorectomy, so taking the fallopian tubes out early and postponing the ovarian surgery until later. So those studies, I think, will come into play. But my takeaway from this is that we know that these surgeries are beneficial. They improve outcomes. That is very clear in this study. They had over 5,000 patients, so it's very impressive. But I think we really need to talk about and focus on how do we take care of our patients who have had risk-reducing surgery, who've been put into early or premature menopause, and how do we improve not just quality of life, but take care of their bones and their brains and their heart and everything in the long run. So I think that as we have this clear data showing the benefit of risk-reducing surgery, we have to turn our attention to how do we take care of this patient population in the long run. And that question and that comment does not just apply to patients who have a BRCA mutation, it applies to anyone who is having, it applies to anyone undergoing premature or early menopause. Love to know comments, takes, anything, leave them in the comments.